broadcasting live from Houston, from the space city to the world. You are watching NowMedia Television.
Hi, welcome to NowMedia's premier medical show, Pain Diaries. I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine, and I welcome you today. In this episode, we have a few special guests. First, I'm grateful to have a special guest who is a distributor for a pain-relieving system to treat and overcome low back pain from the sacroiliac joint. I will also be featuring Mrs. Lanthan, an insurance agent who will talk about how to solve the headaches when it comes to selecting the correct insurance when it comes to open enrollment, especially when it comes to Medicare. Remember, you can find me, Dr. Suzanne Manzi, at Performance Pain and Sports Medicine. My partner, Dr. Matt Wiederholtz, and I host our website at www.performancepain.com, or you can reach us by phone, 346-217-1111. I have two convenient locations spanning across Central and Southeast Houston. Our flagship is located at 4126 Southwest Freeway, Suite 1700, Houston, Texas 77027, in the penthouse of the T-Mobile Tower, next to Greenway Plaza. You can also find me in League City, Texas, officing out of League City Spine and Sports at 1200 East Main Street. Whichever location you prefer, my staff will schedule you at that desired location. And don't forget, tune into Pain Diaries on the following channels: Houston, 2110, Beaumont, 2710, Atlanta, 2210, Lake Charles, 2110, College Station, 1410, Eagle Pass, 24, Piedras Negras, 24, and hear us in Chicago on 102.9 FM and 104.3 FM in Huntsville, Texas. And don't forget to tune into Spotify, Apple Podcast, and Amazon Music. And follow us on all our social media and our digital platforms such as NowMedia.com. Please note, the information in this show is for informational purposes only and is not medical advice. It is not a substitute for professional medical advice, and I urge you to seek medical advice from your physician regarding any medical condition. Reliance on the information provided in this show is provided solely at your own risk. My motto here is, take care of you so you can take care of business. Hello, I'm Dr. Suzanne Manzi, and this is Pain Diaries. Dr. Suzanne Manzi with Performance Pain and Sports Medicine here in Houston, Texas. I welcome you back to Pain Diaries on NowMedia Television. Innovative devices allow us at Performance Pain and Sports Medicine to change lives. Before we start talking medical shop, I'd like to lay down some groundwork. As a physiatrist, a doctor trained in physical medicine and rehabilitation, it's my job to figure out where my patient's pain is coming from. What's causing the pain? How do I assess this? What allows me to figure this out? Some people are actually shocked when I have them stand up and do a physical exam. I evaluate how people walk, how they sit, their behavior with movement, and then I do a comprehensive physical exam that encompasses the entire neurologic and musculoskeletal system. All of this after taking a detailed history and correlation with the proper imaging studies such as X-rays, MRIs, or CAT scans helps me and my partner figure out the true pain generator. We utilize our skills and years upon years of training to determine which part of the spine is involved in back pain. Some of the differential diagnoses of back pain can stem from the discs, the bones, or the vertebrae, the joints, the muscles, or the nerves. There's so many options that can be causing this pain. So how do we figure it out? Let me begin by talking about the sacroiliac joint. This is a large joint of our low back or pelvis that's formed between the sacrum and the ilium bones of the pelvis. It It's connected by spring ligaments, and this joint supports the weight of the upper body. Because it's where two bones come together, it forms a joint, which has cartilage and synovial joint fluid that's present. These joints are not supposed to have large ranges of movement like a knee or a shoulder joint. However, they're capable of small amounts of movement. This powerful joint is also subject to change from arthritis and can cause pain with age. When women become pregnant, the ligaments can loosen, which allows the pelvis to widen to accommodate childbirth. So what is the true function of this joint? Usually, shock absorption for the spine, along with torque from the lower extremities, especially with ambulation or walking. So what is the clinical significance of the sacroiliac joint? This joint, like other joints, can suffer from both inflammation and dysfunction. Sacroiliitis can cause low back pain either on one or both sides. When this joint's inflamed, pain can occur in the low back, buttock, or thigh, or even traverse all the way down the back of the leg, mimicking a pinched nerve or sciatic-like pain. If you have a sacroiliac joint problem, pain can be dull and achy on one side of or both sides of the low back and into the buttock. The pain is usually located and starts at the dimple or posterior superior iliac spine, abbreviated as the PSIS. The pain can worsen when standing from a seated position or when flexing your leg when you go up the stairs. Referred pain can also go to the front of the pelvis, into the groin, and into the hip. Stiffness and pain can worsen when you sit or stand for too long. When diagnosing this, there are a series of maneuvers or provocative tests that can be utilized. We usually put you through a series of 4 to 6 different physical exam maneuvers, as they are helpful to make the diagnosis and are also required by insurance companies for treatments to be approved to help this joint pain. Ironically, the gold standard for diagnosis of sacroiliac joint pain or dysfunction is actually injecting the joint with local anesthetic. This is confirmed when the patient reports over 75% relief with 2 of these diagnostic injections on different days. How do we at Performance Pain and Sports Medicine and most other doctors treat sacroiliac joint pain? Again, we present patients with many options. We always start with a diagnostic injection after conservative measures such as medications and therapy have failed. Ideally, the pain goes away with the conservative measures, but if it doesn't, you should seek out medical advice. After the SI joint is definitively diagnosed as the pain generator with a diagnostic injection, other types of injections can be utilized to treat the pain. Our favorite types of injections are regenerative, including platelet-rich plasma or bone marrow aspirate concentrate. These are healing injections, which can help with the cartilage and arthritic defects within the joint, as well as help repair and strengthen the ligaments that surround the entire joint. Other injections can be with just local anesthetic, which can help reset the nervous system and reduce the pain levels, and steroid to help reduce the inflammation within the joint space. But that's not all we have available. Radiofrequency ablation, RFA, can also be utilized to treat the joint pain. This modality utilizes a heat treatment to the nerves that innervate or go to the sacroiliac joint to reduce pain levels. Well, the most common question I get asked is how do you burn these nerves? When performing radiofrequency ablations to the nerves that carry the pain signals to the joint all the way up to the brain, we utilize an X-ray guidance to visualize our treatment path. We use a needle with a special probe, which is inserted and hooked into an ablation machine, which is almost like a microwave. This machine is set to a temperature of 80 degrees Celsius and only removes the protein sheath over the nerve. It doesn't cut or sever the nerve. Without the protein sheath or myelin that surrounds the nerve, the signal does not transmit, and thus your brain no longer senses the pain from this joint. This is a palliative treatment for the joint pain. The myelin or nerve sheath grows back up to 6 to 9 months later, and the procedure can then be repeated. Another palliative or pain-relieving treatment to the nerves of the sacroiliac joint include nerve stimulation. A numbing injection can confirm which nerve is actually involved, which is usually the medial cluneal nerve. A small electrode can be inserted over the nerve that goes to the sacroiliac joint. This can then be adjusted and controlled by the patient to utilize for the joint pain. Lately, there's been more attention to higher level procedures that fix or stabilize the sacroiliac joint. There's been a big debate among the pain management world, as well as other doctors that treat SI joint pain. There are devices out there that actually fixate the joint from a posterior aspect, the back, a lateral aspect from the side, and a posterior lateral aspect on an angle from the side or back. Today, we have a special guest that distributes KIC Ventures product called Sacrix. Sacrix is the device we at Performance Pain and Sports Medicine utilize to help fixate the sacroiliac joint. I'd love to show you a video right now about that. I hope you found that video informative. The opportunities are endless in helping change people's lives who are suffering, and the different approaches to treating sacroiliac joint pain we utilize at Performance Pain and Sports Medicine are available to all. We're always in hopes of relieving suffering and improving function. Stay tuned for more to come. I'm Dr. Suzanne Manzi here on NowMedia TV in Houston, Texas, and this is Pain Diaries. We'll be right back after a commercial break. Welcome back to Pain Diaries. Dr. Suzanne Manzi here with Performance Pain and Sports Medicine in Houston, Texas. I'm excited to introduce Mrs. Lantan. Thank you for taking the time today to come and tell us about your insurance company and educate us all about insurance on today's episode of Pain Diaries.
Thank you, Dr. Manzi. Thank you for having me. I appreciate it. Our company serves many people in Texas. We also license in Oklahoma. We specialize in health insurance. We help many people in the confusing navigating through what is my needs, what's my network of doctors, and we help them choose the plan that's best for them.
That's definitely always a great resource for people to tap into. I know insurance can be very tricky and it's very hard for people to navigate the system. So I know you like to specialize in Medicare, is that right? Can you tell us a little bit about Medicare?
Yes. So LT Insurance is a broker. We are brokers, so we represent all the major carriers in Texas. What is Medicare? Medicare is health insurance through the federal government because you have worked for a minimum of 10 years, 40 quarters, and you've been paying into the payroll taxes. So you qualify because you'd reached either 65 years old or been disability for 2 years. So let's focus on the one that is turning 65 soon, because every day there's 10,000 seniors that turn 65 in the US. I get calls all the time from people that say, what do I do? How do I start? Where do I apply?
Right. Well, that's great. They have you as a resource. Yes. So when can people actually sign up for Medicare and how? Is it just a 65-year?
Yes, so going back to what is Medicare. So first you have to qualify because you're turning 65 and you work for 10 years. Secondly, what is Medicare? So Medicare is health insurance that have two parts, Part A and Part B. So Part A does not have a premium and it covers hospital stay, anything that is in the hospitals.
Okay.
Part B is the part that is the doctor's office, like they want to go to Dr. Manzi, and they have Medicare. So the Part B is how Dr. Manzi get paid by enrolling them in a plan. How does one sign up for Medicare? Once you meet the qualification, you have two ways of doing it. Either you call into Social Security and say, I'm qualified, I want to turn on the Part A and Part B.
Okay.
The second option would be get on the website of ssa.gov and they go through you put in that you want to start the Part A, Part B.
Okay.
We at LT Insurance, even though it sounds simple, but it's navigating through the process, and a lot of seniors just, when it gets to the computer, the website, they just don't know where to start. You can call us and we can help you walk through the process and request for the Medicare card.
I see. That's great. And then what if you're 65 and you're still working? What do you do about Medicare if you're still working?
Yeah, that's a very common situation for a lot of couples. Let's say you're the husband, you're turning 65, and the wife is not yet 65. She still needs health insurance, and you're still working. And when you work, you have insurance through the company. That's how your spouse, your children can have insurance with them. So you can request only to have the Part A, because Part A have zero premium, and that is the hospital part, and then to delay the Part B. So you can still work and you can still take advantage of the Medicare and only trigger on the Part A. If you are working and you have spouse or family member that need the health insurance through the company. If you're alone and you don't have to have family members that have to have health insurance, we can do a comparison. If I stay with the company and I have the health insurance through the company, what would that benefit look like? And if I go into Medicare, what would that benefit look like? And then we can help you with all the information and make a knowledgeable decision to whether to delay the Part B, because Part B have a premium, or to go ahead and turn on the Part A and B. And at LT Insurance, we sit down with an individual one-on-one, and we provide the service that help them tremendously. Because Medicare, navigating through it, it's very confusing. And health insurance is a personal decision that is based on your health, your medication prescriptions, and your lifestyle.
Absolutely.
Yes.
And so they can just call you or go and reach out to you and you set up a free consultation with them?
Yes, all this is free consultation.
That's amazing.
Yes, we can meet you at your home and sit down in your dining room, kitchen, and we can help you go through it. Or we can do through the Zoom meeting by us talking over, and then we narrow down our recommendation and do the Zoom meeting. Or thirdly, you can make an appointment that meet us at our office. But let me tell you, 99% of my client is either through Zoom or meet them at a coffee shop or at their house.
That's great. That makes it real personal.
Yes.
You get to meet them one-on-one like that.
And once they are our client, Dr. Mancy, because we represent all the carriers, every year we would do a Medicare review for them. So when they have the Part A, Part B, they have two options. Whether they would do a supplement, which is a Part G, Part N, plan.
Okay.
Then they have a standalone prescription drug plan. And then the second option will be a Medicare Advantage, and it's an HMO or PPO. We always start out with, tell me about your health. Tell me who are the doctors, regardless of which plan. Like I have clients that say, I don't care which plan I'm on, but Dr. Mancy needs to accept that health insurance plan. So when we understand your need, then because we represent all the carriers, all different supplement plan, we can know which carrier, which plan to recommend that best fit you.
That can be very confusing for people. I know my patients, they say, oh, do you accept Medicare? I'm like, yes, we do. Just make sure you get the right type of Medicare. And because that can be very confusing to people too, because there's all these commercials out there about different versions of Medicare. And so I always try to navigate my patient to go talk to you because it's so confusing, even for me. I'm trying just to be their doctor, but I have to also make sure that they're educated about their insurance. And I know you do a great job with that. So I appreciate you taking care of all the patients that I've sent you to figure that out for them, because it's too much for me to talk to them about. And you just know much more about it than I do. I just know this is what I'm in network with and this is what I'm out of network with. And patients really need to know, and they want to keep their doctor. I feel like patients that are with me, they do whatever they can, especially if they make a mistake, and get out of network with me to get back in. So I guess, another concern is if that doctor isn't in the network, can the people change their plan? And how easy is that?
Yes, and that is the question that I ask when I sit in front of a client. How important that you need to keep your your physician.
Right.
If that is the most top important, then we will pick a plan that you don't have to worry whether they are in the doctor in this year is in the network and next year they're not. So there is there is health insurance plan that you would never have to worry about whether it's in network or not. Let's say financially that does not fit them, then we will go through the process, and yes, they have the opportunity to switch depending if they have a special reason. So right now, from January to March, they have what is called the open enrollment period, only for the one that have a Medicare Advantage plan, that they are able to switch. You have January, February, and March to switch a Medicare Advantage plan if the plan you're on does not fit your need. After that is lock in for the year. Unless you move out of the county. Let's say, yes, let's say, you know, you moving up to Dallas, different county, then you, because the plan you're on, that county may not, you may not be able to have the in-network. So they meet the special reason to be able to switch plans.
Okay. Even if I move from Harris County here in Houston to Sugar Land?
Well, good question. If it's Harris County, Fort Bend County, a lot of the plan is already in the same group. Okay. We'll look at it and see if there's any other special enrollment options that we can put you in.
That's pretty specialized service right there.
I tell you, that's why coming to us at LT Insurance, being a broker is a big advantage for our clients.
Right.
We spend a lot of time to have to study and renew our license, the certification. Every year, each carriers with all different plans, every year we have to certify again to do it. So you have to love what you do in this business and care
Absolutely.
for the benefits of the people. So
I met Lon probably 5 years ago now, maybe longer. And you've just been so passionate about what you do. And I love that.
Thank you.
And it's been, you know, a pleasure to work with you. And my patients have always given me great feedback that you really go above and beyond to help serve them. So we really appreciate you.
Thank you. And not only do LT Insurance do Medicare, we also do the Marketplace Obamacare. It's called ACA plan. And we also represent all the major carriers out there that we can help them figure out what plan to fit in. And then we also do group health insurance for a small business company that need, they're starting out or they, you know, want to see what the group benefit will be for the like the management level versus the staff.
Okay.
We can also do that.
Wow, you guys do it all.
Yeah, specialize in health insurance.
Another question I have for you that a lot of people have asked me, especially patients that have just moved here, you know, they came from out of state, you know, can they also just enroll directly in Medicare?
Yes, they do, because they meet the special enrollment reason.
Oh, okay.
It's because they move, and as soon as they enroll, it's going to be effective the following month. So let's say they are here in January, they call at 713-569-0590, and I meet with them, get them enrolled. Even on the 31st of January is effective the following month.
That's fantastic. Look at that.
Yes.
I know a lot of people move here because we have MD Anderson here in Houston, and it's a big draw for people to get treatment. And these people are in the most vulnerable part of their life, and they need help. So does Medicare allow them to go to MD Anderson?
That is a very common question that I get asked. Is insurance we buy so that when we need it, it stands up and it supports us. That's when you know whether insurance is good or not. So most of the supplement plan that a place like MD Anderson, they don't have to worry about whether it's in network or out of network, that yes, they can go MD Anderson. The Medicare Advantage side depends on the carriers. For the great news is that 2023, there is one carrier that does allow to go MD Anderson. That is Blue Cross Blue Shield.
Wow, that's fantastic news.
Yes, that is great news. I have one client, actually two, that just was diagnosed with early onset of breast cancer.
Ooh.
So they call me and they're like, Lon, you know, Methodist is great, Memorial, all the hospital is great, but I just want a peace of mind to know that I'm going somewhere that specializes in cancer. But at least they have options.
Of course,
you know?
Options are huge.
Yes, they have options. And like I say, when it comes to health insurance, we want, it's very personal and based on your health.
Right.
So, yes.
Wow. Well, thank you so much for all this information. Is there anything else you wanted to add?
I think that the biggest concern the senior have, and I've talked to Dr. Mancy that maybe he should invite me back later in the year, but the prescription drugs and how much it's costing seniors. The copay, the deductibles, whether it's tier 3, tier 4, tier 5, that gets very expensive. Because of the limited time today, I won't be able to talk about it, but if you have expensive tier 3, 4 drugs, give us a call. We can do a comparison for you so that you can delay getting into the donut hole later rather than sooner. Or the deductibles would be in tier 4 instead of tier 3.
Right.
It's just, there's mountains of information that an individual senior is so complicated. And we take that burden off of you by us navigating and help you going through the process and understanding what your benefits are and if there's something out there that is better for you, because most seniors are on fixed income.
True.
And that can be very difficult where I can't afford it anymore.
This is absolutely true.
Yes.
Well, thank you so much for the wealth of information. Thank you for taking the time to share this knowledge with the world. And we appreciate you. We're hopeful you may be able to help someone in pain obtain the right insurance so they can be seen and their pain levels can be addressed appropriately.
Very true.
I'm Dr. Suzanne Manzi, and this is Pain Diaries. Take care of you so you can take care of business. Thank you, Lon, and we will return after a commercial break.
Thank you, Dr. Mancy, for having me on today.
Welcome back to NowMedia's TV show, Pain Diaries, broadcasting here in Houston, Texas on channel 2110. We're back with Armando Valenzuela. I'm pleased to introduce him and welcome him back to the show. Thanks for being here, Armando.
Thank you for having me.
Sure. Armando's been in the medical sales field for over 25 years of experience. He's worked with various national manufacturers and distributors. His distributorship has the ability to present solutions to his clients. Armando's constantly looking to learn about new products and industry trends to help his clients stay ahead, ultimately treating pain from behind the scenes. Us, as interventional pain doctors, need people like Armando to help us take care of our patients. Armando, since today's episode is all about treating sacroiliac joint pain, with Sacrix, we're looking forward to hearing all about your expertise. First, I want you to tell us a little bit about your experience with the sacroiliac joint and why you decided to carry this product from KIC Ventures called Sacrix.
So, sacroiliac joint pain first came onto my radar because there's been data that shows that lower lumbar pain, lower back pain, sometimes presents itself as SI joint pain and vice versa. About 8 years ago, we came to market working with a manufacturer that saw the data and decided to create a product that would help with this issue. More recently, working with Sacrix, we have found that it's a product that patients have less trauma, less bleeding, and a faster recovery time. So having heard from pain physicians and patients, we felt like this is a better option for us and the people that we support, people that we take care of.
Well, previously, SI joint fusions have been, a larger incision with screws that go across the joint in more of like a trauma type orthopedic fashion. I know there was a couple other devices on the market that come from that lateral approach or even the posterior approach, but there's a big debate on which approach to use. Can you take us back to the more barbaric type ways to do it?
Yeah, absolutely. The first technique that you spoke of, first procedure, was the lateral procedure that used 3 large triangular wedges to go across the joint from the ilium through the joint into the sacrum. That we feel is an outdated procedure. It's more trauma to the patient. It's a more dangerous procedure. There are some gluteal arteries that present themselves that may be an issue. When you do the lateral oblique technique that you are using right now currently, and we are foremost being a proponent of, there is far less bleeding, far less tissue trauma to muscle, tendons, and therefore patients are recovering much faster with a smaller incision as well, and just as good support to the SI joint. The other procedure that you spoke of is a posterior technique in which a piece of bone, what we call allograft, gets placed posteriorly into the joint itself. We feel like that's only providing stabilization and will not provide enough support long term.
Yeah, so we've had this debate. I've had this debate many times with my colleagues. My partner and I are true believers of the posterior lateral approach, where the joint is like this, and we stabilize it with 2 screws that come across. Whereas the posterior approach is, the joint's like this, and we just kind of you put something in there and it stabilizes it, where it comes down directly on the joint, and it's kind of like a doorstop. And it's almost like, well, why are we still leaving the door open a little bit when it's a joint? And if we want it to fuse together, we need it to compress, not jam it open. And so there's a constant debate about this in the pain field between all us as pain doctors and even the orthopedic surgeons, because it's what's right? What's the right thing to do for the patient? I know with this posterior lateral approach, my incision's 1.5 centimeters. It's a tiny little nick, which is amazing. It's so minimally invasive.
Agreed. I hear physicians sometimes say that they feel the allograft technique going straight posteriorly, and like you said, it's a doorstop, and stabilizing the joint can, I guess some physicians feel like that's a better option for them. To us, the proof is in the pudding. Physicians that are doing the lateral oblique technique, such as yourself, their patients are recovering quicker, they are taking less pain meds, and they're actually get on with their lives much sooner than the alternatives from our perspective and from the experience from the physicians that we're working with.
Absolutely. I know with any procedure, there could be some complications. Usually when I tell patients about these kind of procedures, there's risk of pain, bleeding, infection. Have you seen when the wrong tools are used, or can you describe some of the complications that could go wrong with a sacroiliac joint fusion?
Yeah, most definitely. a lot of the times I am actually in surgery with yourself and the physicians that we work with.
Right.
And some of the techniques that we're speaking of, not lateral oblique, there can be some complications with the amount of bleeding, the amount of trauma, getting a piece of allograft into the joint and trying to stabilize it and wedging it open can be difficult sometimes, and it definitely provides more trauma to the patient. The lateral oblique technique is very simple. You go in with what we call a jam sheety needle that has an open cannula that you put a guide wire through, and the screw goes over the guide wire. There's no need to impact any of the tissue or the ilium or the sacrum in the pelvic area.
Yeah, and we have to be careful too. I mean, like you said earlier, there's those gluteal arteries. Those are big arteries. The last thing we want to do is hit a blood vessel.
Absolutely. Hitting a blood vessel and would require probably the help of a vascular surgeon or a general surgeon.
Right, and if we do have a large amount of bleeding there, you can form a compression onto the sciatic nerve and cause hematoma, which is a collection of blood that could cause pressure on the sciatic nerve, and that could lead to nerve injury down the leg. So the most important thing that we as pain doctors want to do is to treat patients with the least risk. We want them to recover and do great, not have a complication.
Absolutely. The procedure that you're doing is to avoid patients being in pain, to avoid them taking pain medication. So what you're offering is less risk, quicker recovery, and avoiding pain medication, which is a hot topic in the world of medicine right now.
Yeah, this procedure has been great, especially recovery-wise. People can get the pain relief after they have this procedure done, with just some anti-inflammatory and just Tylenol. You don't necessarily need pain medication because it's such a small little incision. And
Agreed. We've seen it across the board, several 100 procedures, and patients are getting back to work quicker and having to take less pain meds.
Yeah, the function after this procedure is really awesome. It's been exciting to see the way the landscape's changed with these interventional techniques that are now available for us pain doctors to be trained on and to do for our patients, whereas the patient doesn't necessarily have to have a big orthopedic surgery anymore to have this fused or fixed or stabilized.
Absolutely not. The technique has become safer, less invasive, and therefore not necessary for an orthopedic surgeon to execute.
And in the intro on the show, I described the whole process of working up SI joint pain and what is the SI joint. And in order to qualify for a sacroiliac joint stabilization procedure, we usually do the diagnostic testing with the injections first to say, yes, this is really the pain generator. And then we do try some of the other more conservative things first, such as injections or regenerative medicine, ablation, possibly even peripheral nerve stimulation to the nerve that goes to that joint. But mechanically, I think the SI joint fixation or stabilization with Sacrix is kind of the ultimate fix for someone with chronic SI joint pain.
Yeah, absolutely. To your point, typically diagnosing this or any musculoskeletal issue is done by imaging, MRI, or x-rays. This technique or this diagnosis for SI joint pain is slightly different. It's confirmed with injections into the joint, and providing the posterior lateral technique as an option has been a much better option. So, agreed.
Yeah, no, that's great. So besides the Sacrix procedure, which we've kind of talked to depth about, are there other things that other devices or other products that you carry with your company from the makers of Sacrix?
We do. We carry what we call an interspinous device, It's used to decompress the spinous process for central foraminal stenosis
Of the spine?
of the spine.
Yes.
Similar to the Sacrix product, the interspinous device, compared to other options, with pedicle screws that go into the spine as well, this is a less invasive, less traumatic technique, which again will keeping in mind we want the patients to get back to work. We want to get the patients to avoid taking opioid medication, and falls in line with the overall KIC ventures and what we like to present as, you know, better options and less invasive techniques.
So are there a lot of doctors doing these procedures with you around the Houston area?
We have a few. We have a few doctors that are in the Houston area that are using both of these products. Woodlands, Sugarland, Med Center, pretty much all over Houston, yes.
Yeah, and myself and my partner, Dr. Matt Wiederholtz, we are true believers in these products because we get great outcomes for our patients. And that's the ultimate goal, you know, making the right diagnosis, treating the pain, and making people functional again. That's our goal at Performance Pain and Sports Medicine. And you know, I'm here on Pain Diaries to educate people that there's options. There's great options that are out there people don't know about.
Absolutely, absolutely. We're here to listen to our physicians, provide solutions for them, and help treat their patients, help support them in the best way they feel to treat their patients.
Well, thank you, Armando. Anything else you'd like to add for us today?
Oh, I appreciate the opportunity to come on and have this conversation, and hope that we can get the message out to more people about the techniques and about the products that we have to help care for our physicians' patients.
Thank you, Armando. We greatly appreciate you being here on today's episode of Pain Diaries. If you or a loved one is suffering, please know there are options. Find your nearest pain expert in the field to see if you are a candidate for amazing medical technologies like the Sacrix procedure, which can change lives for the better.
Thank you so much.
This is Pain Diaries. I'm Dr. Suzanne Manzi. Take care of you so you can take care of business. We'll be back after a commercial break. Hi, Dr. Suzanne Manzi here with Pain Diaries. I am so grateful for our special guests we had on today's show, Mrs. Lan Than, teaching us about Medicare and our options for insurance, as well as Armando Valenzuela, discussing Sacrix and all things related to the sacroiliac joint as a pain generator that can cause back pain. Me, Dr. Suzanne Manzi, and my partner, Dr. Matt Wiederholtz, at Performance Pain and Sports Medicine, are happy to help. We treat pain, we treat you, we treat your family. Our goal is to get everybody feeling better so everybody can be functional and do what they love. Again, I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine here on NowMedia TV. Thank you for a great show, and we'll see you next time.
This has been a NowMedia television feature presentation. All rights reserved.